Welcome YouTube family, this is Busy Hands here back again. Today I'm going to take the time to put together a video. It's going to be a long one that details my history with my back pain, and you might want to grab yourself a drink of water, grab a comfortable chair and come with me on a journey. Full disclosure, I'm not a medical professional, so whatever's worked in my story or my case has worked for me, but don't let that discourage you from taking hope or being able to relate, or knowing that you're alone in this world when dealing with these trying times if you're in the same boat. So I'm going to go through my journey from the past 2 years. I'm going to detail you the medications I was on, the medical imaging that I had done, the pain that I went through, dealing with the medical system, dealing with all sorts of professions, my surgery, my outcome, you name it. I'm going to try and be as detailed as I can to leave no stone unturned, and hopefully you've got no questions, but if you do, feel free to leave them below and I'll get back to you about it. Disclaimer, what we're going through, I think that's about it. Let's do it. Okay, so this whole journey begins back in December of 2018, where I approached my GP about lower back pain that just didn't disappear. So I got my first referral to a physiotherapist. I'd never been to a physiotherapist before, so I went through with the physician who said, yep, you've got some, so my complaints were basically a really tight lower back, couldn't touch my toes, felt like the hamstrings in my left leg were very, very tight, and didn't have much flexibility at all. So from the very beginning, I was given a bunch of stretches to help lengthen out the muscles before we could even start the exercises, and those stretches helped quite a lot, but there was a lot more to build on. So from that point there, I had multiple physiotherapy appointments, and each appointment led me to be progressing the intensity of my exercises. And as a note, from the start of January in 2019, I took photographs of myself to keep track of my physical fitness and my progress along the way. So let's have a look at those right now, and I will walk you through where we got to. So the first two images, the start of January, the start of my exercising regime, the start of all the exercise that I was given by my therapist. So fairly chunky around the midsection there, can definitely admit that. And at that point in my life, I was not doing a great deal of exercise. I was very sedentary when it came to work, home, drinking a bunch of beers before bed, and then just rinse and repeat. Didn't take much of my physical health into account. Okay, so mistake number one: stay active and drink lots of water. So every week or so, I would take a picture, one from the front, one from the side, and I'd like to document my progress to make sure that I was still on track and that I was working hard enough, okay? And it got to a point, I pushed through the pain, and yeah, things got really good, and I started to achieve some really, really good physical results, and I was happy with how my body was looking. And then in July 2019, I was destined to go overseas for a friend's wedding, and from that point, things, I was optimistic. When I went on holidays, I took some protein with me so I could stay, on top of my exercises, even though I was away from home. And I did all these exercises at home. I didn't have a gym membership or anything like that. At the time, I couldn't see the point in paying for it, right? But during that holiday, food was abundant, food was cheap, and eventually my good habits fell to the wayside, and I put on a couple of kilograms. Can't remember exactly, but I think by the end of it, my core strength had really gone through the floor, only because I'd eat so much that my body would be like, okay, let's just let it all hang. I'm not going to keep any of these core muscles tight for the stomach. I'm just going to let it all relax and hang out. And so we might have been heading on the steep decline from that point. Okay, so I came back, got back home, and I remember that I developed a bit of a strange feeling that it was hard to be able to convey it to someone at that point, because I hadn't felt anything like it before, but it felt like that hamstring tightness returned, and I had a knot in my leg, like in the back of my knee, and I couldn't escape when it let go. So if you imagine like a really tight piece of fishing line or something like that, and then someone just cutting it with a pair of scissors or something like that, that elastic band stretchiness, sort of electric shock, these are all sort of descriptive words that I would use of what that pain felt like shooting through the back of my leg. And it would happen when I would go from like a sitting to a standing position. And I don't think anybody else really knew what the hell I was talking about, even though I was in a fair bit of pain every time it would happen. It would happen fairly frequently, and at that point I should have listened to my body and said, yeah, something's not right here. Okay, so we're now post-July, we're in the July-August sort of area. I returned to my physio and I received a bunch of glute strength exercises, despite at the time having symptoms of sciatica. Okay, so at that point I was doing a lot of Googling, a lot of trying to figure out what the heck was going on with my body. And I was convinced that I had maybe 3 or 4 different things. And it's hard to be able to convey those sort of things when you've never experienced it before. At one point I thought I might have had Piriformis Syndrome, where the nerve doesn't glide through the piriformis muscles in the pelvic region, causing a tension feeling in the back of the leg. All these sorts of things that I was still learning about my body, and I definitely encourage anyone else who wants to know more about their condition to just read, just do your own research, and you'll know what's specific to your situation or not. But anyway, the amount of pain that I was in was starting to creep up there, and it was starting to really bother me in my work life and day-to-day life. So I returned to my GP, and they prescribed me with a drug called Lyrica, whose generic name is pregabalin. Okay. I was told to take a 25 milligram tablet twice a day and steadily increase until I felt some relief from the discomfort that I was getting. It didn't take long for me to reach 150 milligrams twice a day, and at that point I felt really whacked out of it, like it's not being a drug, it's not nice to be under the influence of. By about midday, I felt like I was just about to hit a wall and crash and needed to go to sleep. And it was really hard to push through to until the end of the day, and then I got home again ready for the next dose. At the time I was also taking the maximum advised level of Nurofen or ibuprofen, and I was told that level of sustained dosage can't be good for your body by my physio. And I said, yeah, well, hopefully this is only a short-term thing and we fix this back up again. So yeah, it didn't get better. Things started to get worse, even though I had these pain medications and I was exercising, trying to push through this pain. But yeah, so I returned back to my GP and they referred me for a CT scan on the lower spine. And the results came back, and the radiologist said, we need to see an MRI as well. We need to get an MRI happening. And then they sort of flagged a neurosurgeon to get a second opinion on this scan in the end of November. So at that point I had one CT scan done, and I was booked in for an MRI in the beginning of December. I went back to my physio, and they advised me, because I was spending quite a lot of money with them and I didn't have private health care, that I see my GP about being signed up to a care plan through Medicare, and that allowed the patient, me, up to 5 visits subsidized by Medicare. And I opted to have 3 visits back to my physio and 2 visits to an osteopath. Now that lasts, I think that renewed every 12 months for people who have chronic conditions, okay? So I used my 3 physiotherapist visits in December. And then I was booked in to get my MRI done, and the MRI came back, and I looked through all my medical imaging. I did a lot of research, comparing, contrasting what my images look like compared to a healthy person's spine, someone with DDD or degenerative disc disease, just a whole bunch of reading about what the heck was happening to my body, what it should look like, what it shouldn't look like, basically. So I want to take the time now to show you the results of my CT scans and my MRI scans, and hopefully this is going to take a long time, but hopefully I don't make too much of a fool of myself trying to explain things as I go. So here we go. All right, onto the medical imaging side of things. The first set of images I'm going to show you are CT scan, which stands for computed topography, and that's basically a whole bunch of x-rays that are taken in slices, if you will, that I used to be able to generate a three-dimensional image that can be used by professionals. So the first stack is going to be the bone from the left through to the right. Okay, so let's have a look at this. So if you were to follow me through, it's gone from the left to, no, sorry, it's gone right to left. So it's going this way across me. Let's see if we can't reverse it, and we'll go left to right. So the images count down. Alright, so we should be all the way at the right hand side here. At the left hand side. And each slice is taken at 3 millimeters. So every 3 millimeters represents a new, every picture, represents 3 millimeters deeper. Okay, so we're starting to see this here is the pelvic area, the sacral spine, and we're just starting to see the edges of the vertebrae, okay? And we keep going here, we start to see more as that slice goes deeper and deeper into the left side. And we can start to see a spine taking shape. Now, a nerve map basically allowed me to point out that the problem where I was feeling pain meant that I was looking for the nerve that enters the spine, or exits the spine rather, at the L5-S1 level. Okay, so this here is the beginning of the sacral spine and the end of the lumbar spine. So there's 5 lumbar vertebrae, 5, 4, 3, 2, 1, and starts at the S1, S2, blah, 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 all the way. So my problem lives here at this level, and you can start to see that there's something doesn't look right compared to the rest of them. If you were to, if you were to cut this out and stack it on top of each other, this level here doesn't look right. Okay, what we've got, medical term, is a disc prolapse. So the disc, this bone here is basically moved underneath this bone, and the cushion material has been allowed to slip between the two, and it encroaches on the space between the vertebrae. So as we cut further through, I'll show you that space that it shouldn't enter. Okay, so these here are what are called the lamina. Facet joints. So these are your facet joints, and these allow your bones to stack on top of each other and not wobble all over the place, all right? So they keep everything in a line, straight up and down. And this gap here is no good, and starts to look even worse. So this here should be sort of aligned in the middle, but it's quite a fair way out. And as we go further, we start to see these spiny looking bits on the back of your backbone. They're called the lamina. Okay, they form the lamina, and between the vertebral body and the lamina is a space, this nice big channel. Now this nice big channel here actually houses the spinal cord, and at each level of vertebrae, the spinal cord leaves, and those nerves run to various muscles and, you know, run your whole body. Otherwise you're just a bag of meat without electrical signals, right? So this here basically tells us that there's an issue there. This is with the X-ray settings on calibrated for bone. So I'll just quickly show you what it looks like with the soft tissue, and then we'll go to the MRI. Okay, so this sort of allows us to see a little bit of soft tissue surrounding the bone. Okay, so we can see the muscles, the ligaments and whatnot, sort of. Doesn't give us quite as detailed soft tissue as an MRI, but we can sort of begin to make out that there's soft material between the vertebrae. All right, next, MRI. Okay, so now we're going to be looking at a lovely silhouette of me. Only you get to see inside me. This is the MRI of me straight down the middle if you were to cut me this way. And it's pretty easy to figure out that this is my head, this is my front, this is my back. These images are taken lying down, and we want to focus down here, okay? Down here is where we've got issues, so let's bring up those pictures, shall we? Okay, so we're moving from left to right now as we cycle through. Where are we going? Okay, so image 1 through to 15 goes from left to right. So let's have a look. MRI, remember, is good for the soft tissue and reveals a bit more. So this slice here is taken, and we can start to see the vertebrae showing up there, and the darker spots in between is the disc, okay? Intervertebral discs. And it becomes more and more clear, and these white spots are the ligaments that hold the spine from toppling sideways, and they occasionally need stretching out too. Now we're starting to see the nerve roots that exit. Okay, so down here at the L5 and the S1 junction, this is a nerve. Here's a nerve, 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 nerve. They're all nerves. There's white bits, right? So now we're starting to enter into the intervertebral, the intervertebral cavity space, something like that. This is where the spinal cord runs through, okay? So as we cut further through towards the center and get to the next one, it'll be the center. So this is one before the center. On the left hand side we can see this section, faulty section, is the disc prolapse into the intervertebral space. I'll have to double check that. But it's squashing something that shouldn't be right there, and it becomes more and more clear. Okay, so this whole white space between the spiny bits on the back and the vertebrae should be a clear image. This here is probably the clearest image of the spinal cord in that space. Okay, and as I go further towards the right, I don't have so much of an issue with that spinal cord being pressed on. Only the left, which seems to be more apparent right here. right? 1, 2, 3. And then from the center, 1, 2, 3. Not so much squashing. But anyway, that's the medical imaging side of things done. Oh no, wait, there's one more. I want to show you being cut this way. One moment, please. Okie doke, so right now we're looking at slices going from top to bottom, and I want to show you what a good nerve root looks like. Okay, so this here is, I'm not too sure what level of the spine, but it's obviously been used for comparison. So this here is the spiny bit on your back. Oopsie, that's the spiny bit on your back. Come back, where are you? This is the spiny bit. This here is like your vertebral body, where the disc and the gelatinous jelly bit that cushions the forces, and this here is the cavity for the spinal cord, right? This is the right hand side, this is the left hand side, so we're working our way from feet to head. So this here is, the white space is soft material, okay? So these spaces here are fairly unimpeded, they're good, there's no squashing happening there. Everything looks not too bad in comparison to this set of images, which, if I find it, here. It's only a slight difference, but at the end of the day it means a hell of a lot. So this nerve root here is fairly free and unrestricted. This is the right hand side. And now the left hand side, which I surprise I'm getting a lot of pain, seems to be narrowed. So this section of the disc is squashing against the bone here, okay? So I know this all looks a bit, unless you've really studied your own imaging or other people's imaging, this might seem a little bit difficult to follow for now, but I'm going to now show you a three-dimensional model of my spine. So the CT, you know how I was saying it was a bunch of slices? Well, those slices can all be put together and formed into a model that you can swivel and look around at. So let's do that now. Welcome back to the party. I'm now using some software that I use for my 3D printer. The really cool thing about Horus Project is that you can export STL files, which are used for 3D printing. So once the software models all the slices, then it can then send that computed file off to other pieces of software. So what we're looking at here from the front is my pelvis, right? And we will spin around to the back so you can see what's going on there. Right. These here are the vertebrae. These are the sides of my hip bones, and this is the sacral spine here that's all fused. Now, let's have a look from the side. We can see very clearly that the bones have nice gaps. The vertebrae have nice gaps between them, which would be occupied by the annulus fibrous, which is the outer ring that contains the squishy jelly, and they look good. Now these joints on the back here, they are your facet joints, and they once again are used to keep your vertebrae all in a line and stop them from wobbling this way and that. Now, for L5S1, let's zoom in here a little bit. We can see that the S1 isn't positioned directly underneath the L5, and that is basically where we've had trouble, because the jelly disc material has basically slipped out the back while, so let me explain this a little bit better. So the two bones have shifted sort of against each other, not in a really bad way. A really bad case of that's called stenosis, where basically you get joints slipping forwards or backwards to the point where the spinal cord is severed, and that's not good. I don't have that, thank God. And to prevent that from ever happening, I have to be very careful with what I do for the rest of my life. So that gap is narrowed, the disc hangs out the back. Now we're going to rotate around to the back, and we're going to zoom right in, and we're going to see what the heck is going on. Alright, follow me here. Follow my cursor. This section here, right? This section is occupied by the nerve root. So it runs from here and then comes out through the side. Alright, so it comes out through this gap here. And if we come back in, the issue is that disc is pressing the nerve between this bone. So, not good. And what ended up having to happen is surgical intervention, where basically a piece of bone was drilled out, ground out. But we'll get into that later. So we're just looking at the diagnostic imaging for now and what has gone wrong in my case, okay? So this section of bone here, this section of bone here and the disc, nerve in between, no good. Alright, enough medical imaging for now. On with the story. I want to thank you guys for watching thus far, but the video is getting a bit too long for me to upload all at once, so what I'm going to do is I'm going to split this into a part 1, part 2, and this is the end of part 1. So follow my channel, or if I leave a link somewhere here, follow it for part 2. Thank you.